Did you know patients only get about 11 seconds to speak before they're interrupted? Shocking, isn't that? Welcome to our Patient Experience QuickTip on the pause method. In the drive for efficient healthcare, we've seen a shift towards shorter, more tactical appointments. This change is aimed at increasing productivity, but it often leads to providers interrupting patients early in the conversation. In fact, research shows that providers often interrupt patients after only 11 seconds. So picture this, a patient starts to speak and after only 11 seconds of the conversation is totally hijacked. So what does this do to the patient and how does this make your job more difficult? From a clinical perspective, some interruptions can redirect the encounter productively, aiming for accurate diagnosis and treatment. However, it's important to emphasize that interrupting patients just seconds within their initial explanation is not ideal. Surprisingly, when not interrupted, patients only speak for an average of 29 seconds. So consider this crucial moment. Patients begin to share their stories, their concerns. Interrupting them can only derail vital parts of the consultation. And remembering Einstein's wisdom of understanding a problem is essential for solving it, without fully grasping the patient's situation, the risk of misdiagnosis and ineffective treatments increases. So as somebody who studies provider and patient interactions, I've seen how striving for efficiency can lead to patients feeling undervalued and unheard. And this is more than just about communication. This is about patient care. When we interrupt, we're not only alienating our patients, but we're potentially contributing to a cycle of increased healthcare visits. What's often dismissed as patient noncompliance might actually be a sign of our incomplete understanding. So, what can we do to kick this nasty habit? I recommend the pause method, and this is simple. After you ask the patient a question, pause for a few seconds. And when you feel the urge to speak or pipe in, consciously count to 3 before you say anything. This brief delay allows you to consider if the patient has finished their thought, and it also gives them an extra moment to add in any additional information if needed. This shows that you value their words and gives them the opportunity to provide more context, leading to better patient care, but also better patient experiences. Remembering that by refining our listening skills and reducing interruptions, we're not just enhancing communication, we're reaffirming our dedication to patient well-being and fostering stronger, more trusting relationships. Remember, our goal is to create healthcare environments where every patient feels valued and understood and heard. So, until our next quick tip, let's remember to listen more, interrupt less, and always care deeply.